Noticing a yellow tint to your newborn skin? It's a sight that sends a jolt of worry through any new parent. But that yellowing, known as jaundice, is incredibly common. You might have even heard a classic piece of advice from a well-meaning relative: just put the baby in the sun. This is used even in hospitals, because in many hospitals across Africa and other low-resource settings, the incubator might not be working. And while there's some surprising science to back that up, doing it the wrong way is downright dangerous. In this video, we'll break down how light can help with jaundice safely, and, most importantly, the #1 thing you must do to help your baby. We're going to cut through the myths and give you the facts, because when it comes to your baby, there's no room for guesswork. What is jaundice and why does it happen? So, what exactly is this yellow tint? It's called jaundice, and it affects a huge number of newborns, somewhere between 60% and 80% of full-term babies, and up to 80% of premature infants. It is the visible sign of a high level of a substance called bilirubin in the blood. Think of it like this: our bodies are constantly breaking down old red blood cells. A byproduct of this is bilirubin, a yellow pigment. Normally, our livers process this bilirubin and help us get rid of it. But a newborn's liver is still immature. It's just getting up to speed. It can't always process the bilirubin fast enough, especially in the first few days. So, the bilirubin builds up in the blood and, since it's yellow, it deposits in the skin, causing that yellowish look. It usually shows up first in the face and then moves down the body as the level increases. For most babies, this is a normal temporary condition called physiological jaundice. It typically appears 2 to 4 days after birth and resolves on its own within a couple of weeks, no harm done. However, in some cases, bilirubin levels can get dangerously high and require medical treatment, which is why your pediatrician keeps such a close eye on it. As a nurse or caregiver, you should watch out for yellowing of the skin starting from the face and spreading downwards, yellow sclera, eyes, poor feeding, lethargy, baby too sleepy, high-pitched crying in severe cases. A simple way to check: press gently on the baby's skin. If it appears yellow when released, jaundice may be present. Why is it dangerous? Now, here's where it becomes serious. If bilirubin levels become too high, it can cross into the brain and cause a condition called kernicterus. This can lead to brain damage, hearing loss, seizures, even death. That is why early detection and treatment is critical. The sunlight solution, how does it work? The standard medical treatment for significant jaundice is called phototherapy, which involves placing the baby under special blue-green lights. This specific wavelength of light is like a magic wand. When it hits the skin, it changes the bilirubin structure into a form that's water-soluble. This new version can be easily flushed out in the baby's urine and stool, completely bypassing the liver's to-do list. Baby's blood can also be replaced to reduce bilirubin quickly. But what happens when there is no electricity? The phototherapy machine is faulty? The hospital is in a rural setting? This is where sun therapy comes in. This brings us to that old folk remedy, sunlight. And it turns out there is real science here. Sunlight, of course, contains the same therapeutic blue light spectrum, so in theory, exposing a jaundiced baby to sunlight could have the same effect. This has actually been studied. Research, particularly in countries where medical-grade phototherapy is hard to come by, has explored this. One key study in Nigeria found that when babies were treated with sunlight passed through special canopies that filter out harmful rays, the treatment was safe and nearly as effective as conventional phototherapy. Sunday therapy must be controlled and supervised. It is not leaving the baby under harsh sun, exposing the baby for long hours, ignoring temperature and hydration. How to use sun therapy safely. Here's a step-by-step guide. 1. Timing is critical. Best time: early morning, 7 a.m., 9 a.m., or late afternoon, 4 p.m. to 6 p.m. Avoid midday sun, it's too harsh. Point 2. Positioning the baby. Undress the baby, leave diaper on. Place baby on a clean surface or mother's lap. Turn baby every 10 to 15 minutes. Back, front, sides 3. Protect sensitive areas. Cover the baby's eyes, very important. Protect genital area if needed. Point 4. Monitor temperature. Babies can easily develop hypothermia or overheating. Always check skin warmth, baby's activity. 5. Hydration and feeding. Encourage frequent breastfeeding, helps eliminate bilirubin. 6. Duration 15-30 minutes per session. Repeat 2 to 3 times daily depending on severity. 7. Close monitoring. Check if jaundice is improving. Refer immediately if baby becomes weak, stops feeding, jaundice worsens. Therapy is not enough. Sun therapy is helpful, but it has limits. Refer urgently if jaundice appears within first 24 hours. Baby is premature. Bilirubin levels are very high. Signs of brain involvement appear. Sunlight is a temporary supportive measure, not a replacement for medical care. The critical dangers of direct sunlight now. Before you rush to put your baby by the window, this is the most critical part of the video. The American Academy of Pediatrics and other major health organizations are crystal clear. You should not expose a newborn to direct sunlight. This might sound like a total contradiction to what we just discussed, but there's a massive difference between raw, unfiltered sunlight and the carefully managed light used in medical treatments. A newborn's skin is incredibly thin and delicate. It lacks the protective pigment and maturity of adult skin, making it extremely vulnerable to the sun's ultraviolet, or UV, rays. Just a few minutes of direct sun can be enough to give an infant a painful sunburn, which you might not even notice until hours later. A sunburn on a baby isn't just distressing, it can be a serious medical problem. On top of that, direct sun exposure carries risks like dangerous overheating, hyperthermia, and dehydration. Even more seriously, UV radiation exposure in childhood is a major risk factor for developing skin cancer later in life. The damage done to skin cells in these early months can have consequences decades down the line. Because of these serious risks, putting your baby in direct sunlight, whether outdoors or even through a car window, is not a recommended treatment for jaundice. Some resources suggest that placing a baby in a bassinet near a bright window, but not in the direct sunbeam, might help. If you are finding this information helpful for navigating these early days of parenthood, please take a second to subscribe to the channel. Our goal is to provide clear, evidence-based guidance to help you feel confident and empowered. Your support helps us reach more parents just like you.